Hello, I'm Amy Hollingworth, the director of the Safe Sports Network, and I'm here today with Dr. Beaver, and he's talking about athlete screening. Dr. Beaver, can you tell us what you feel is the most important takeaway for athletes or parents or coaches to know regarding athlete screening?
I think it's important for parents and athletes to know that the incidence of having a sudden cardiac event during participation is very rare. So from a screening standpoint, I think getting an athlete screen should be prompted by any family history of having sudden death in the family, or athletes that are symptomatic that beyond what they would expect as normal from symptoms like chest pain, shortness of breath, feeling like they're going to pass out. So that's when they know that it's important for them to go get screened. I think that we don't have enough information to know how to screen the general population at this time, so that's not something we recommend.
Excellent. So they shouldn't expect when they're going into their normal physical to have an EKG or screening such as that?
No, they should be walked through a symptom profile, get a standard cardiac physical exam, and those are the things they should expect when that happens. Routine EKG screening or getting higher level studies like ultrasounds is not something they should expect to be getting.
Dr. Beaver, can you tell us what you feel is the most important takeaway point about athlete screening in regards to the healthcare providers?
I think from the standpoint of healthcare providers is to know that there's not a current recommendation that they should be screening all of their high school and school age athletes with things beyond history and physical examination. That it's very important because they have a role in the community in taking care of the athletes and actually screening them to find abnormalities. But most people have some sort of symptom prior to having a sudden event. So asking the screening questions that are available, doing the physical exam to investigate to see if they have abnormal murmurs or other physical exam findings is really the most important thing.
Excellent. And from an athletic trainer standpoint and the pre-participation physicals and screenings, would you recommend if there's a red flag that athletes are referred to their PCPs and pediatricians or referred straight to cardiology, or maybe it makes a difference? Or
I think all providers are sort of important. I think we use a multidisciplinary approach from the standpoint of that. So, we all have our different expertise, and primary care physicians are no different. I think that it's important to make sure that that person is aware of what's going on with the athlete, but I think it's a discussion between the athletic trainer and the primary care provider to see if they're comfortable investigating that, or they want to push it to the next level to have them see a cardiologist or someone that's more specialized and in tune to the athletes and screening them and interpreting test results.
Excellent. And what would you say is the biggest buzz around athlete screening right now?
I think it's still the controversy about knowing when to screen athletes, and are we asking the right questions, are we doing the right tests, and what are the things that are preventable? I think that's the hardest thing for the general population to understand is, as physicians, no matter what we do, we can't achieve zero risk in competitive sports. So we don't like things to happen, but things are going to happen, and that's where having medical action plans and people that know how to work with emergency services to make sure if some event does happen that you can get someone help fast and get where they need to be.
Excellent. Well, thank you for your time, Dr. Beaver, and have a great day.
Thanks for having me.